Hey guys, I'm Dr. Duncan, and this is Wednesday Night Live, and I'm joined by Ron Veitel.
Good evening.
Good evening. We're at Siskiyou Vita Medicine here in Medford, and we're having a great time. We're doing a little leisure painting in the room, so if it looks like we're on fire, it's because we are. No.
We've got the sun behind us.
Yeah, we have the sun just
wall.
rocking behind us. It's amazing, and we have the beautiful sun coming in. So, really enjoying it right now in this room. So, we've been super busy around the clinic, having a good time. I've been seeing a lot of patients, and something keeps coming up, and that is this theme around men and weight gain and libido and energy and depression. And what else? Insulin resistance. I have this questionnaire that I do with patients, just checking in, and I'm typically checking in with women, and I ask them about their energy and their libido, and they end up telling me, well, mine's fine, but my husband's is not there. So I often say, well, why don't you just bring them in and we can talk about that. So let's talk about that tonight. There's so many factors that go into men's health, but one of the sort of premier issues that's going on right now is that a lot of men are suffering from low testosterone. And I'm seeing this a lot of times. I'll just do a check, just a couple of random lab tests here and there if I suspect it, or doing a urine test, and what I'm finding is that a lot of guys are coming back with low T. And sometimes you can see this in guys, if guys have large guts, or if they're sedentary, or if they're working a lot and they have a desk job, they're not eating correctly, or they're not exercising, then you can sort of suspect that a man might have an issue with testosterone. So why is testosterone good for guys? Testosterone is great for mood, it's great for mental clarity, it's good for the heart, it's great for the bones, prevents osteoporosis, it's good at retaining muscle mass, and it's great at maintaining a healthy weight and maintaining libido, which means sex drive and the quality of erections. I just don't know any way to say that, kid friendly or not. So it's important, and we know that there are a lot of things that block healthy testosterone production in men, and one of those Ron and I were talking about was cortisol, and we talk about cortisol all the time. We talk about adrenal glands, and we talk about gut dysbiosis and microbiome. And so if you've been tuning in, you know that we've sort of been hitting around this theme for a while. But to address it directly, how does cortisol block testosterone?
That's an awesome question, because cortisol is our long-term stress hormone. It's also a circadian rhythm hormone. It's what helps us wake up in the morning. But it's also what our adrenal glands use to help us handle daily stressors. But it seems like we're under so much stress anymore that we're constantly getting this cortisol release.
Right.
And so when you have long-term elevated cortisol, what that begins to do is it has a downstream effect on our sex hormones. And so the raw material for cortisol is cholesterol. And cholesterol gets converted into a hormone called pregnenolone. And then pregnenolone actually will get converted to progesterone. So we all have progesterone. Most people know it as, women work with progesterone and estrogen, but us guys have progesterone as well. And the raw material for cortisol is progesterone. But in a healthy, functioning physiology, what happens is pregnenolone will get converted into DHEA. And a lot of people use DHEA as a supplement to boost their estrogen or their testosterone.
Right, or support adrenal function.
And that's usually kind of like when the adrenals are getting pretty far gone there.
Right.
But then also the progesterone will convert into androstenedione.
Okay.
And androstenedione will eventually convert into testosterone. Well, what ends up happening when we have long-term elevated cortisol is that progesterone gets shunted into just producing cortisol.
Right.
And the conversion of progesterone to androstenedione gets blocked. And the conversion of pregnenolone to DHEA gets blocked. So all the pregnenolone is going to progesterone, and all the progesterone is going into cortisol. So if you think about this over a long period of time, think about how much stress people are under in this day and age.
Right.
And men tend to work a lot of hours.
They neglect themselves.
I mean,
they don't sleep well.
Well, in the beginning when you're saying, one of the core things about, men's health and testosterone, I was actually going to butt in and say that men don't take care of themselves.
Right.
Most people taking care of themselves, actually, 4 out of 5 health food store shoppers are women. Women are much more interested in their health than men are. And
that's why I'm having this conversation around men's health through their wives.
Exactly.
Right?
Exactly.
And the other thing about cortisol, elevated cortisol, leads to sort of this dysbiosis, which leads to all kinds of things, but insulin resistance. Mm-hmm. So the more weight a guy puts on, the more testosterone is going to be converted to estrogen. So there's this aromatization that happens.
That's right.
So if you're gaining a lot of midsection weight,
which is the spare tire, which is a cortisol issue.
That's a cortisol issue. Exactly. It's an insulin issue. Mm-hmm. So insulin resistance breeds obesity, breeds aromatization, meaning we're breaking down testosterone into estrogens, which breeds insulin resistance, which goes to elevated cortisol, which leads to gut dysbiosis. So it's all just kind of interconnected, but we're not taking care of ourselves, right? And a lot of guys are drinking IPAs and drinking the beers, or they're not moving their bodies. Mm-hmm. They're just going to work, they're doing their duty, and they're coming home and don't have the energy or the drive to engage with their partners. They don't have the drive or the energy to exercise or move their bodies. They're just too exhausted.
They're exhausted.
And everything's stressful, whether you're driving your car. I mean, when we talk about stress, it's not, you have to move out of your house today kind of stress. It's really the day-to-day kind of things, right? Meeting deadlines, dropping the kids off at school, getting an email that you may have not expected, or work-related stuff, just kind of everyday stuff.
Finances.
So anything, right? Waiting at a red light. So we're all exposed to these things, and we're really focusing on guys tonight. So guys experience this in a drop of testosterone, which is a drop in their feelings of vitality. Mm-hmm. And so what we'd like to do is just kind of share some ideas with you that might help you mitigate, or help the guys in your lives mitigate their conversion of testosterone to estrogens, and mm-hmm. help them kind of bring some vitality back into their lives. So managing stress is huge, and I know I see Maria Lupuma watching, and awesome, because she talks about stress all the time. Ron and I have a lot of conversations around stress, and getting people to really think about things differently from a different perspective, so things aren't so stressful when you can come from a different point of view. And so managing cortisol is huge.
Exercise.
Yeah, I think you're right. Exercise is probably the largest, most impactful thing that we can do, especially as guys.
You said something in a conversation we were having the other day about where the most testosterone is produced when we're exercising our largest muscles. Is that what? Would you clarify that?
Yeah. So when you exercise and you do high intensity workouts, exercising the large muscles in the body, so the quads, the glutes, that really stimulates testosterone production of the testes. So if we as guys can do like a high intensity workout, do something for about 90 seconds, as hard as you can do it until exhaustion, and then take a break for a little bit, and then bust back into it and do something else high intensity, but focusing on the large muscles of the body.
So squats.
Yep, squats, lunges. What do you call the leprechauns?
Shaking the hand of the leprechaun.
Yeah, shaking the hand of the leprechaun.
I won't demonstrate. Don't worry.
Don't do that. Sprints. If you can do just a good sprint.
Hiking uphill.
Yes, uphill, climbing stairs, that sort of thing. Jumping rope. anything to engage the big muscles of the body, you're going to stimulate testosterone production. And it also helps you become more sensitive to insulin, and that reduces obesity. So, you're working through multiple pathways here. It's not just one pathway. I'm going to build muscle and I'm going to build my testosterone that way. It's really working through multiple mechanisms. Right. So it's really good to be more open-minded about things and to learn more about different ways about how you can affect your testosterone. So working out big muscles is probably one of the best things you can do. Exercise for all of us in general, but especially guys, it's a huge deal. We need to move our bodies. We need to engage our muscles and remember what it's like to be strong and fit.
Yeah. Yep. It's a major issue right now. And so
yes.
we've taken up that challenge.
We have.
And we've been doing morning workouts Tuesday, Wednesday, Thursday before we get going.
Right. Yeah.
And we're feeling it.
Yeah, I feel sore.
It feels good.
Sore, and I have sore muscles, and I actually love it.
But I feel more clear.
Right.
I feel more energized, and I also feel more calm because that exercise is a great way to lower cortisol levels. Mm-hmm. It helps handle stress. So anything we can do to lower stress, so mind-body awareness techniques, whether it be meditation, breathing, yoga, tai chi, qigong, those are all really important in helping to lower cortisol.
Yeah.
We can also use different herbs and supplements to help lower cortisol. Herbs like ashwagandha, holy basil, eleuthero, also used to be known as Siberian ginseng. Mm-hmm. These are all really great herbs to start bringing the cortisol down. And then there's some plants that are really great for elevating testosterone as well.
Yes. So to help elevate testosterone, foods rich in zinc or supplement with zinc.
So pumpkin seeds.
Yep, pumpkin seeds. Let's see, what else do I think about? Ashwagandha. So ashwagandha before bed can help improve testosterone levels, and I think it's a part of a cortisol pathway there. But passion flower. If guys are having trouble sleeping, take a little bit of pregnenolone. Zinc really helps. I'm going to go back to zinc, but zinc really helps with blocking the aromatase, so the conversion of testosterone to either DHT or estrogens. So we want to kind of focus on zinc-rich foods, maybe supplementing with them. Nuts and seeds are really good. You mentioned pumpkin seeds, but Brazil nuts are really good.
Yes.
Lots of selenium there. So fiber in your diet is really good. Controlling your insulin levels. So if you can eat a diet that's low in processed sugars and carbohydrates, and get more towards the healthy fats, proteins, and vegetables, I think that you're going to improve your insulin sensitivity and reduce the amount of fat you're carrying around in your body, which is going to improve your testosterone levels. So outside of injecting testosterone, there are various ways to just increase it naturally, right? So exercise, we said, managing stress, foods, herbs, some medications that we can use on occasion. There's one called clomiphene. It's a selective estrogen receptor modulator, and it blocks. So the pituitary is sensing hormone levels in the body. So we're blocking estrogens through clomiphene. So that'll stimulate the testes to produce more testosterone. Some people have been on HCG, which stimulates testosterone production through the testes. I see a lot of guys that have been on testosterone therapy from other practitioners, and I'm always curious about that. As a guy taking testosterone, just without anything, without doing all the other work, you're sort of selling yourself short in that you're turning the testes off.
Right. And so which you really don't want to do.
No.
You don't want to become dependent on an outside source to produce our inner forces, so to speak.
Exactly.
So all the things we're talking about are ways to stimulate your own inherent production of testosterone. And now you can use those. You had talked something, I think it was in our conversation yesterday, as a matter of fact. You talked about a way to use these things to shut testosterone down a little bit and then to turn it back on. But I don't think that was a really healthy...
So, you'll see a lot of bodybuilders will go out and they'll do rounds of steroids. They'll do testosterone, and then they'll use HCG to turn the testes back on because it stimulates the Leydig cell in the testes. I don't know if that's the healthiest thing in the world to do.
It doesn't.
But guys on testosterone, initially you're going to feel more energized. You're going to have more energy. You're going to feel sharper. And I think that we're sort of feeling some of the effects from the exercise like that, right? So I feel much sharper. I feel sort of stronger. I just into my body more.
Yes.
But if we're not careful with injecting testosterone and you're not doing all the other things like a comprehensive treatment plan, you're going to end up making more estrogens out of that testosterone. So potentially you could just raise your estrogen levels really high, despite having high testosterone levels, right? So you're sort of just not getting anywhere. So it's really useful to find ways in which you can, cut that weight, cut the cortisol, get the exercise,
right,
and eat right. Really.
And insulin resistance is a big thing here with testosterone. And we see so many people with blood sugar dysregulation issues, so many people who are flooding their system with glucose through eating refined carbohydrates, which then causes this insulin surge and eventual, over time, insulin resistance, which, so getting your diet really dialed in, making sure you're eating healthy carbs, low glycemic carbs that break down into glucose in a much slower manner than the refined carbs. That's why we really, Dr. D and I talk a lot about the paleo diet and the ketogenic diet. Those seem to be the two that we favor the most.
Right.
Because they tend to focus, one with the ketogenic diet, much lower in carbohydrates, much more restrictive.
Yes.
And then the paleo, you're getting out the grains and the beans and the legumes and all these starchy
we call
foods.
Them the lectins.
The lectins, exactly.
We like to get the lectins
out. So
the other thing about, I think people need to understand about insulin's, besides getting blood sugar out of the bloodstream and into the tissue to be used as fuel, insulin's other primary job is to store fat.
Right.
So,
exactly.
It's a storage molecule. So if your insulin's high, if you're eating the bagel with the low-fat cream cheese, you're really not doing anything. You're actually telling your body to store more of that than if you were just to eat the cream cheese.
Right. One other thing's popped into my head to talk about, and that is avoiding xenoestrogens.
Yeah, that's huge.
So xenoestrogens are these synthetic estrogens that are in our environment due to plastics and pesticides. And so if you're drinking water out of the squishy water bottles, you don't want to do that because they leach estrogens. The plastic leaches estrogens into the water. And our tap water is actually full of estrogens. As well. So clean water source, reducing your use of plastics, minimizing your consumption of food sprayed with pesticides, all of that will, because those xenoestrogens are going to increase your estrogen levels or your synthetic estrogen levels, and that's going to block testosterone as well.
Yeah, and it's going to block the production of testosterone because, again, your brain is going to be sensing estrogen levels in the body, and if estrogen levels are low, you're going to make more testosterone. But if your estrogen levels are high, then your body's going to say, well, I must have enough testosterone. So then it's going to shut down the production of testosterone in the testes. So it's a very complex issue. So, if you guys are feeling like slow and sluggish and you're gaining weight and you're losing muscle mass and you're just not as sharp as you used to be and your libido is gone, maybe even a little depression has set in, then consider getting your testosterone levels checked. And if your guys have any of those signs and symptoms, have them come see us. We can check their testosterone levels. We can look at their cortisol levels. We can look at metabolic conditioning, and we can actually train the body to switch from being insulin dependent to being more fat dependent. So we can actually burn a guy's fat, have the body burn fat as fuel versus burning this dirty sugar as fuel.
That's right.
Yeah. And that's a big deal.
That's a huge deal. I always tell people that the glucose is like coal, and fat is like a solar energy.
Totally,
it's like the difference. It's a clean energy source.
Right. You can produce twice as much energy from a gram of fat than you can from a gram of sugar.
Yep. Without the free radical production.
It's amazing.
Yeah.
It's amazing, and no wonder it works for epilepsy and neural inflammation and in some cases cancers and so to learn how to burn fat for fuel is key. Learning strategies at home that you can use to increase your testosterone levels is key. And then if supplementation is needed for a short period of time to sort of prime your body to get it back into testosterone production mode, I think why not? I think that would be useful. But the goal here is not to replace your body's own production of testosterone. It's really just to stimulate you to produce testosterone. I always tell people, what if the zombie apocalypse happens and you've been on testosterone therapy for several months? If you stop getting your testosterone, your testes are on vacation. Good luck. You're just going to be a crying wimp on the side of the road.
Mm-hmm. Yeah. The goal of anything, I think, and this would be a naturopathic mindset, I would imagine, is that our goal is when we're giving you something, it's to stimulate your own inner forces to do their job.
Yes.
That's really the goal.
I mean, that's ideal, right?
Yeah.
I'm a huge fan of freedom,
mm-hmm.
and I don't want to be tied down to anything that's going to prevent me from experiencing life the way I want to experience it.
Mm-hmm.
And that is a medication, an herb, right?
Yeah, exactly.
Like, I don't need to be tied down to that. So the recommendations, like you said, that we give are really to make you stronger, to get you to a place where you have free choice over your health and the direction of your life.
Yeah, exactly.
Absolutely.
I think that might be our time.
I think that's it, guys.
That's awesome.
So again, if you guys are interested in testosterone therapy or looking at optimizing testosterone, or you've been gaining a little bit of weight or you're not feeling right, give us a call, come talk to us. We do free 15-minute consults. Tell your friends, pass the word along. We'd love to sit down and talk with anybody. So go ahead and you can email us at admin@sisqvitamedicine.com, or you can call us at 541-210-5687.
And you can post up questions here on our Facebook page.
Yes, please. If you guys have questions about this subject, please post and we'll answer them. And if you guys have ideas for next Wednesday Night Live's topic, yeah, then please put it there. And
absolutely. If there's anything you want to hear us talk about, let us know.
Yeah, we're happy to do it.
Awesome.
Thanks, guys.
Thank you, everyone. Have a good night. Have a great week.
Cheers.